Hi everyone, and welcome to the Paul Chandler Show. I'm your host, Paul Chandler. In tonight's discussion, we're going to be discussing type 2 diabetes, and we'll be learning about the clinical side of it in a fun, animated way. So stay tuned, and we'll be right back with type 2 diabetes. Hello everyone, Captain Awesome here again, your good friend. And today we're going to talk about type 2 diabetes. Now, type 2 diabetes is a chronic condition that affects the way your body metabolizes sugar, known as glucose, an important source of fuel for your body. With type 2 diabetes, your body either resists the effects of insulin, a hormone that regulates the movement of sugar into your cells, or doesn't produce enough insulin to maintain normal glucose levels. Type 2 diabetes used to be known as adult-onset diabetes, but today more children are being diagnosed with the disorder, probably due to the rise in childhood obesity. There's no cure for type 2 diabetes, but losing weight, eating well, and exercising can help manage the disease. If diet and exercise aren't enough to manage your blood sugar level very well, you may also need diabetes medications or insulin therapy. Signs and symptoms of type 2 diabetes often develop slowly. In fact, you can have type 2 diabetes for years and not know it. Look for increased thirst, frequent urination, increased hunger, unintended weight loss, fatigue, blurred vision, slow healing sores, frequent infections, and areas of darkened skin, usually in the armpits and neck. You should always remember to see your doctor if you notice type 2 diabetes symptoms. Type 2 diabetes develops when the body becomes resistant to insulin or when the pancreas is unable to produce enough insulin. Exactly why this happens is unknown, although genetics and environmental factors, such as being overweight and inactive, seem to be contributing factors. Now, insulin is a hormone that comes from the gland situated behind and below the stomach, known as the pancreas. The pancreas secretes insulin into the bloodstream. The insulin circulates, enabling sugar to enter your cells. Insulin lowers the amount of sugar in your bloodstream. And as your blood sugar levels drop, so does the secretion of insulin from your pancreas. Glucose is a sugar and is a main source of energy for the cells that make up muscles and other tissues. Glucose comes from two major sources, food and your liver. Sugar is absorbed into the bloodstream, where it enters cells with the help of insulin. Your liver stores and maintains glucose. And when your glucose levels are low, such as when you haven't eaten in a while, the liver breaks down stored glycogen into glucose to keep your glucose level within a normal range. Now, in type 2 diabetes, this process doesn't work very well. Instead of moving into your cells, sugar builds up in your bloodstream. As blood sugar's level increases, the insulin-producing beta cells in the pancreas release more insulin, but eventually those cells become impaired and can't make enough insulin to meet the body's demands. In the much less common type 1 diabetes, the immune system mistakenly destroys the beta cells, leaving the body with little to no insulin. There are several risk factors that may increase your risk of getting type 2 diabetes, which include weight, fat distribution, inactivity, family history, race, age, prediabetes, gestational diabetes, polycystic ovarian syndrome, and areas of darkened skin, usually in the armpits and the neck. Type 2 diabetes can be easy to ignore, especially in the early stages when you're feeling fine. But diabetes affects many major organs, including your heart, blood vessels, nerves, eyes, and kidneys. Controlling your blood sugar levels can help prevent these complications. Although long-term complications of diabetes develop gradually, they can eventually be disabling or even life-threatening. Some of the potential complications of diabetes include heart and blood vessel disease, nerve damage known as neuropathy, kidney damage, eye damage, slow healing, hearing impairment, skin conditions, sleep apnea, and Alzheimer's disease. Healthy lifestyle choices can help prevent type 2 diabetes. And that's true even if you have diabetes in your family. If you've already received a diagnosis of diabetes, you can use healthy lifestyle choices to help prevent complications. If you have prediabetes, lifestyle changes can slow or stop the progression to diabetes. A healthy lifestyle includes eating healthy foods, choose foods lower in fat and calories and high in fiber. Focus on fruits, vegetables, and whole grains. Getting active, to aim for a minimum of 30 to 60 minutes of moderate physical activity or 15 to 30 minutes of vigorous aerobic activity on most days. Take a brisk walk daily, ride a bike, swim laps. If you can't fit in a long workout, spread your activity throughout the day. Losing weight, because if you're overweight, losing 5 to 10% of your body weight can reduce the risk of diabetes. To keep your weight in a healthy range, focus on permanent changes to your eating and exercise habits. Motivate yourself by remembering the benefits of losing weight, such as a healthier heart, more energy, and improved self-esteem. And also by avoiding being sedentary for long periods. Sitting still for long periods can increase your risk of type 2 diabetes. Try to get up every 30 minutes and move around for at least a few minutes. Now, sometimes medication is an option as well. Metformin, or oral diabetes medication, may reduce the risk of type 2 diabetes. But even if you take medication, healthy lifestyle choices remain essential for preventing and managing diabetes. And that's all we have time today, but now you have a good standard understanding of type 2 diabetes. So back to you, Paul, at the Paul Chandler Show studio. Bye-bye now. And thank you for your time in watching that education moment on type 2 diabetes that affects approximately 31.5 million Americans. Tonight's episode of the Paul Chandler Show is brought to you by Clear Physician Services. So again, thank you for watching and have an awesome rest of your night. If you like this video and want to see more, make sure that you subscribe to our YouTube channel. It's so easy. It's right there. A little button. Just push it. Subscribe. I got all night. Nothing else to do. Just subscribe.